This video is for educational purposes only and does not replace official training, local protocols, or medical advice. Always follow your specific agency guidelines and medical control. Imagine someone is very sick or badly hurt, and they can't breathe on their own. To help them, paramedics need to put a special breathing tube right into their windpipe. But there's a catch. The body's natural reflex is to fight this. If you've ever accidentally swallowed water down the wrong pipe, you know you cough and gasp. To fix this, medical teams use a super-fast, teamwork-heavy process called Rapid Sequence Intubation, or RSI for short. Think of it like a pit stop in a race car track, where everyone has a specific job and they have to move incredibly fast and carefully. Here's how it works. Step 1. The oxygen supercharge. Before doing anything else, the medical team places an oxygen mask over the patient's face. They want to fill the patient's lungs completely with 100% pure oxygen. This gives the patient a safety buffer of extra air, so they stay safe while the tube is being put in. Step 2. The sleepy juice sedation. Next, a specific medicine is given through and for to make the patient fall fast asleep in just a few seconds. This is important so they don't feel any anxiety or discomfort during the procedure. Step 3. The freeze switch paralytic. Right after the sleep medicine, they give a second medicine called a paralytic. This temporarily pauses all the muscles in the patient's body, making them completely relaxed. It stops the patient from gagging or coughing, which makes it much safer and easier to slide the tube in perfectly. Step 4. Placing the tube. Once the patient is totally asleep and relaxed, the paramedic uses a video or direct laryngoscope to see clearly. They carefully slide the plastic breathing tube past the vocal cords and into the windpipe. Step 5. Double-checking the work. The very second the tube is in, the team tests it to make absolutely sure it's in the right spot. They listen to the lungs with a stethoscope, take note of chest rise, lung expansion, check for misting in the tube, and monitor end-tidal CO2. Once they know it's perfect, they use a BVM or, if available, hook the tube up to a mechanical ventilator. Step 6. Post-intubation care and pain management. Just because the tube is safely in doesn't mean the job is done. Having a plastic tube in your windpipe is highly uncomfortable, and the initial sleepy juice wears off quickly. To keep the patient comfortable and prevent them from fighting the ventilator, the medical team immediately starts ongoing long-term pain management and sedation through the IV. Continuous analgesics and sedatives ensure the patient remains completely pain-free, calm, and resting safely while the machine breathes for them. It takes a lot of practice to get this right, which is why medical teams train constantly to make sure they can do it smoothly, safely, and comfortably in under a minute.